And tonight we're joined by David Sotto, as I mentioned, a Congregante who graduated here in Miami, went to Atlanta, founded the Atlanta student group, the Aqua Atlanta student group at Georgia Tech, passed to Congregante in Atlanta, graduated from Georgia Tech with a bachelor's in biomedical engineering, and then a PhD also from Georgia Tech in bioengineering. So, a quick question, David, before you start, what is the difference between those two?
Very little. The only bit I think is in bioengineering, you can use a bit of a broader definition, and it's not only about hospitals.
Okay, very good. Good. All right, David. So I'm going to let you kick off the presentation. We got some individuals here in Miami following us, as well as our audience on YouTube, and we'll listen to what you have to say, and then we'll kick off a bit of a discussion.
Awesome. Thank you so much, Eric. Appreciate it. And by means of other kind of quick introduction bits for this one, for today, the presentation that I shared, I actually recently shared with the Atlanta student group a couple weeks back. And it's kind of just an interesting and relevant topic where we're looking at what the Catholic Church's role has been in the coronavirus pandemic response. And by way of background and introduction on this bit, my work is a bit more involved on pandemic response. I work at the Bill Melinda Gates Foundation as a strategy officer and kind of serve as part of our central strategy team across our full portfolio, where we spend somewhere around $6.5 to $7 billion a year, focused on kind of global health priorities, global growth and opportunity priorities. So think about economic development in many cases internationally, and most of our focus has been on the African continent, India, Southeast Asia, but we also do a lot of work on education in the United States. So there's no part of the world that has not been touched by the pandemic. And we kind of took this opportunity to ask the question of actually, what is the church doing? How is it involved? When we think of comprehensive and global pandemic response, what are some of the bits and pieces by which we can try to make sense of where the church has stepped in as a central actor in a lot of this? And then separate, kind of what can we do about it as individuals? How can we get involved with our local communities? And how can we get involved a little bit more globally? So I'm going to share a couple of slides, and then we'll make sure to reserve a good portion of the time to be able to answer questions from the group. So just to orient us a little bit on this one, what are we talking about? We're talking about the COVID-19 pandemic. It is, it has been causing worldwide death, and it puts significant stress on public and private health systems. And when we're thinking about numbers, I mean, these numbers change on a daily basis, but as of latest figures that I've seen, right, we're talking about over 9 million cases globally. We're getting close to that 500,000 death count globally, and in the United States, it should be no surprise to anyone here that we're talking about a significant portion of what the global figures look like, right? A quarter of all global deaths have happened in the United States, and this is something that has been growing, continues to grow, and it's going to be changing our new norm for the world for a while. So to be able to make a sense for how has the Catholic Church been involved in the response and the recovery of COVID-19, we're going to be using a construct that isn't necessarily perfect for this, but helps us organize how can we look at the church's response. And this is a framework that was prepared by the United Nations on their development support plan. So it's intended to be, how can a government think through its components of its response across 5 buckets? And we'll loosely use this just to make a sense for how has the church been involved in the health component of COVID? How has the church been involved in protecting people, social protections, and something around kind of social cohesion, so community resilience as a central actor in how we think about people's response and people's engagement in this moment of crisis. And then 2 other buckets, one on how do we think about it from an economic response standpoint? How do we think about it as a kind of enabling opportunity for individuals? And then one that might be a bit surprising for the group is actually how has the church been involved in macroeconomic policy, macroeconomic response, which in most cases folks think of multilateral organizations like the UN, the IMF, kind of those types of entities to be involved, the church actually has had a pretty substantive role in this space. So we'll use this construct. And let's first dive into health and how has the church been involved in the health component of the pandemic. This is one place where I find it most interesting, and I often forget how heavily involved the Catholic Church is at the front lines. When you start to look at some of the facts and figures, and I'll share this presentation for folks that are interested in looking a little bit deeper into it. I won't talk to a lot of the facts today. But the Catholic Church in the United States alone runs a ton of the hospitals, ends up actually running a significant portion of frontline work. We're talking over 600 hospitals in the United States. It's something close to 12% of all hospital admissions in the United States happens in a Catholic hospital. So when you're thinking about how is the church involved, the church is involved specifically in a very hands-on way. So when you start thinking about systems that are being pressured, hospital systems that are working at their absolute capacity or working above utilization because we're flexing extra hours for our frontline workers, a lot of it is pressure that's directly being put on the church. And the church's response is one and the same when we think of frontline work. This becomes even more important when we start looking globally. Globally, when you think of health systems, especially in some parts of Central Africa and Southern Africa, when you think of health systems in India, especially northern India, some of the poorest portions, or in East India and in West Bengal, formalized healthcare providers don't necessarily exist in the same exact way as we would think of in the United States or in Western Europe when you've got kind of like really fixed government provided systems. A lot of it is actually run through missions, and a lot of them are run through Catholic missions. And this becomes very real when you start to look at some of the numbers around it, right? On the African continent alone, we're talking about over 1 billion people. You've got something over 74,000 religious sisters, 46,000 priests that operate over 7,000 hospitals. So when you think of definitely presence in the United States is quite significant. When you think of presence and criticality in different parts of the world that are actually being hit the worst by pandemics like this, and in the past, other epidemics, right? We've had an uptick in Ebola cases as well during this time in the Democratic Republic of Congo. Those are places where you cannot disentangle the role of the church and the role of your health system. One other place that I think most people typically jump to is the church's role in protecting people and actually serving as a bit of this connective tissue for communities, and also building kind of the backbone for resilience in many places. One place, I think also a bit of a point of pride that we should take in solace with the church is that when we are rolling out social distancing policies, rolling out safety precautions, the church is actually one of the first ones to act in a way where we actually closed a substantial portion of churches to be able to alleviate high concentrations of people. We jumped towards virtual adaptation and actually learned a lot from Protestant churches in many cases that actually had some of these systems in place to date. But we've taken on kind of a new form of how do you actually virtually adapt to these types of systems. I mean, sentiment alone is actually we're meeting in that format right now. Are we going to continue to keep formats like this into the future? Possibly, and most likely. And it's actually opened a pretty interesting argument within the church on whether there has been kind of an interesting growth trajectory when you're thinking about bringing younger people to the church. This virtual format and this virtual opportunity has actually started to open the aperture a bit when you think about bringing new people to the faith. And then the church has historically been very active from an advocacy standpoint. I think especially if you think of the U.S. Conference of Catholic Bishops, there are certain stances where they've basically taken a pretty strong leap on advocating for rights. And two places where this has become very relevant recently has been around the rights of people with disabilities. So the USCCB had actually published a recent press release that's focused on making sure that hospitals are thinking about the rights of people with disabilities in moments like this where you are dealing with medical triage in a way that's very real, right? Who do you decide gets the ventilator in the hospital when you're capacity constrained is very often to basically say the person on the bottom of the list is a person dealing with a certain disability, even when the disability is irrelevant to the condition. that might be respiratory, like in what we're dealing with COVID-19. How do you make sure that we don't lose that point of equity for our population? Another group has also been quite strong in advocating for testing availability, especially for migrant workers and migrant workers that do not have access to healthcare in a similar way, have been somewhat ignored as a vulnerable population within the United States. There have been some places where the church has had a very strong stance from an advocacy standpoint. And this is all on top of still being kind of a central hub for community engagement. How do you deal with dialogues of different communities that are suffering from COVID-19 in different ways, right? People are dealing with parental challenges as schools are closed. What do you do with your kids while you're also trying to juggle work? The church has stepped in many cases, and this is more of a case-by-case basis by archdiocese, but serving on how they can help support families that need flexible cash, serving families where they can actually start to pool resources to help take care of each other's kids if it's in an isolated community. How can we be a bit more creative, and how can we engage each other in communities like this? One place that's also been kind of a hot topic for debate is how do you actually deal with the sacraments during this time in a virtual mode? This is one that I'm really curious to hear from you all and how you've seen this manifest differently in different archdioceses. But it has been one where it feels like it's been a bit more case-by-case basis. And one of the places where, you know, the virtual portion of church engagement is probably not going to stick in the long run, especially when it comes to components of the sacraments where the physical contact is so important for a lot of this. So we should definitely talk a little bit more about that in discussion. A third area that I did want to touch on is the church's involvement from an emergency response standpoint. You know, when we think of this time, we don't just think about the health impact. We do think about the economic impact, right? Unemployment is through the roof at this point in time. Social safety nets are definitely being stressed as much as possible in the United States, and you actually have to pick and choose and figure out, you know, is it a first come first served model for a lot of the stuff? Think of small and medium businesses and the loan programs. Think of unemployment checks during this time. Think of advocating for the service industry. And is it okay for people just to get fired during this time to be able to protect the business, or can there be more done to support hunger rights programs for Americans? And then this only becomes more exacerbated when you think of international programs. But the church has actually stepped in a couple of ways. One is that we've actually hosted a couple of emergency response funds. So there's the Vatican Emergency Response Fund that I encourage everyone to kind of look into. This was a little bit different because it's not redistributing capital that donors give to the relief fund to be able to give it to people and communities. This is an emergency response fund that was set up by the Vatican Church to be able to help redistribute capital across branches of the church. So one example is there was like an excess of ventilators through some portions of the church in Western Europe that actually had been repurposed to send over to Syria when we're dealing about some places that are very capacity constrained. What does that look like? How do you shuffle money around? And all of this is actually very impressive to be doing during a time where the Vatican has been historically dealing with serious budget challenges. And you can read much more about that, but we've definitely been net negative in the Vatican for a while now. And on top of all of that financial strain, managing an emergency response fund like this that is a bit of an internal brokerage is a difficult thing, and it's a very bold, I'd say, for the church to have taken on. Separate to that, the Catholic Relief Services is another interesting program that runs a lot of the international programs on health and hunger relief. It's something close to, like, I think they move something close to $1 billion a year, so pretty substantial. I'd encourage anyone that's interested in learning more about the Catholic Relief Services definitely to dive into and look into it. I've left some links on here for folks to do a bit of follow-on research. And then think of local dioceses have all actually launched a number of COVID-19 emergency funds that help serve families that are in need within their purview. And the Archdiocese of Miami has the COVID-19 emergency fund. I definitely encourage you all to look at it, consider donating, and thinking how you can actually help spread the word for something like this, but also help make sure that you are providing ideas for better ways to serve communities in need with those dollars. That's the biggest bit around economic response and recovery. This becomes heavily fragmented the more you look into local communities. And we can definitely talk a lot more about it in discussion. The fourth and one of the ones that I thought was actually most interesting is, and I found myself scratching my head a little bit about this, was how is the church involved in macroeconomic policy? How is the church involved in kind of influencing the dialogue that happens at the multilateral level and multinational level? And one thing that actually came up that was pretty interesting was the Vatican hosted this workshop in February of this year. And this was a workshop that was partially in service of the International Monetary Fund's managing director, who recently took on the post back in October of last year, in thinking through new priorities for the global economy. And we can't ignore, like, during this time, we were already in kind of peak moments for the COVID-19 crisis in China. That had already spread to some parts of Taiwan. South Korea was figuring out, do we go big on testing, like kind of their early emerging parts of the strategy. And everyone was fearful for what the economic impact would be if this spread outside of that geography. There were some interesting bits if you actually go off and read the outputs of the workshop, where Pope Francis' statement on making sure that economies are in the service of the people was quoted quite regularly in here. And all that we shouldn't get complacent, right? You are seeing global inequality gap close. And that's the global inequality gap if you're looking at the richest countries versus the poorest countries. But when you start to dive into individual countries, and in a moment like this, where countries are actually locked down, and we're not talking about a global economy anymore, we're talking about domestic economies, you actually still see this massive inequality growing when it comes to income. And that gives you a very worrying dynamic where when moments like this hit, and you were seeing this very real in the United States, right? The highest unemployment submissions, the biggest impact for net income for a family, households that are affected the worst are the poorest and are historically vulnerable populations. What system should be in place to make sure that that solves a lot of this in the long run? What should the role of government be? What should the role of philanthropy be? And think of philanthropy in a broad sense, big institutions, to you as a concerned resident, as a concerned citizen that gives a significant amount. And when you think of philanthropy in the United States has the track record of being one of the most giving countries when you have a sum of all the citizens that are giving during this time. So how can that capital be redeployed and make sure that the economy is better suited to kind of pad and protect moments like this? Interesting that the church was actually quite strong in this, not just as a voice that was providing input, but also as a convening power that brings different entities together to actually discuss this and land on some form of resolution. With this, I do want to close with a couple of thoughts on how you can get involved as individuals and some useful resources that could be cool for everyone to kind of learn a little bit more about what's going on in the world related to COVID-19 and related to the church's response. The first is definitely check with your local parish. I'm sure in this moment in time, there's more than enough opportunities for you to give and help. This could be through donations. This could be through signing policy petitions. There's so many opportunities for volunteerism during this time. Even if you think you're trapped at home, there are virtual volunteering opportunities like phone call drives and all that could be an opportunity for you to be involved. Also think both locally and globally. As of right now, you're starting to see the cases climb in Latin America more than anywhere else now. Think of the cases that are going on in Brazil. We're talking about, I think it was like 35,000 new cases in one day that occurred yesterday in the country of Brazil. Think of places that have connections to home, connections to family, and figure out what can you do as an individual. But I would also kind of put the challenge out to what can the ACU do as a group. And then during this time, continually educate yourself, right? There's constant change in this world related to COVID-19. The facts change on a daily basis, actually change on an hourly basis. So how do you keep tabs of where the need is and what are some best places to get involved? Not just in response right now, but there will be a recovery and a rebuild phase over the course of the next few years. This is not something that's going to disappear. And when we think of the global economic hit, right? The latest numbers that I saw from the IMF earlier today is that we're getting closer to the 5% shrinking of global economy, not the 3% number that we saw back in April. So this is an evolving situation. There are a couple of resources here that I wanted to flag that could be interesting to see. One is, and this is a bit of like a shameless plug for work that I do. The first one is we recently launched at the Gates Foundation this donation platform that can help you just figure out what's going on in your city. If I'm interested in giving to inequities, what are some community foundations that I could look at and get involved in? The Catholic Relief Fund shows up in this. There's a lot there that can help you navigate how and where should I give and what's going on in the world related to education, related to health, related to different causes. I think it's also important just to keep track of what's going on as far as the numbers, case counts, what cities, what states are getting hit, what is testing capacity looking like. The Johns Hopkins University Resource Center, I think, is a very helpful one for folks to have just saved. And then the International Health Monitoring and Evaluations site has been pretty interesting to follow projections. I think you've probably seen these in some of the White House briefings over the course of the year. It's one of the preferred models out there. And then there's two other ones that I thought were more kind of just interesting for you to dive into. The fourth bullet here, the Health and Economic Recovery Tracker, is a tool that helps you actually go down to an individual county level in the United States and look at what's happening from an economic standpoint and what's happening from a health standpoint, right? When the relief bill hit earlier this year, where did consumer spending go up? Where did it go down? Where did it have no effect? How did that pair with health cases that were hitting in those states? For example, if you looked at West Virginia as a state, when the relief bill hit, that was immediately consumed by consumers in the state. So it actually had a direct impact on how people were changing behaviors and that there was kind of a need for that cash. In some other parts of the country, it didn't have an effect. So if you wanted to look into your county and try to get a bit of a better sense of what's happening there, I think that's one of the best trackers out there that combines private information, public information, and looks at both health and economics. And then the fifth one is like a New York Times article that actually just continually tracks what's going on with vaccine development, what's in the pipeline, how are they advancing, what are we seeing involved during that time. I think there are probably more comprehensive ones out there. I think it's just a cool, easy, helpful visual for folks to keep track of what's going on in the world of COVID-19. And with that, I'll pause and we can open up to questions. Eric, feel free to flag any that are coming through the YouTube channel. Anyone that's in the room, feel free to unmute and share your questions directly.
I want to see if you could just quickly give us an update, if you know, on where is the vaccine development currently?
Yeah, so the latest that I've heard, and I know Fauci had spent a bit of time talking about this earlier this week, but there is the belief that we can actually have an approved and viable vaccine end of this year, sometime before April of 2021. Now, the big question is how fast can you scale it? What are the efficacy numbers going to look like? I'm a bit more conservative on this one and do believe that we would be seeing a viable vaccine at scale closer to July to September of 2021. Wow. But it depends a lot on the pipeline. The one thing I do want to flag is, yes, the vaccine is really the solution if you think about kind of going back to some sense of normalcy. But there is a lot that could be done once we have viable treatments that are out there as well. If we get really good at contact tracing, if we get really good at identification, we've got widespread testing, viable treatments that could be out in the next few months at the levels of, the efficacy levels and safety levels that we want, will go a real long way. So I wouldn't just think of the vaccine as the place that we're gunning for. There's a lot that could be done in the near term.
And is this going to be a vaccine that it's going to have a new strain every year, kind of like we deal with the flu?
The design of this one is that it's specifically solving for this strain and this subset of strains that we would imagine came from the COVID-19 virus. It doesn't necessarily, at least the belief right now, and this is, I'd leave it up to like the much better scientists to describe it, is that it's not likely to evolve the same way as we think of the annual flu or the seasonal flu. Mm-hmm. So once that's resolved and once we've got that vaccine in place, that's specifically solving for what we're dealing with right now. You'll likely still have your seasonal flu changes, but it shouldn't be a seasonal COVID-19 change.
And is this going to be a vaccine for one time all your life, kind of like when you got the smallpox vaccine as a kid and you're done?
It depends on the solution. I think most of them, the way that they're actually being designed, is a one-time vaccine. Who knows if you're going to need boosters in the long run? But I'm also curious to hear if anyone else is a little bit more involved in the trials. We've got new vaccine science that's actually going into this one with mRNA vaccines and stuff like that. That changes the equation a lot. But the jury's still out on what's going to be the winner, and it's effectively, is it a one-time or does it require boosters?
That's cool. Do you know of any, the numbers on the Catholic hospitals really caught me off guard. When I think Catholic response, I think spiritual response, I think prayerful support, I think sacraments. But when you hit us with all those numbers, the millions of healthcare workers and hundreds of hospitals, it kind of illuminated my mind of, wow, there are lots of Catholic institutions and Catholics themselves on the front lines.
Exactly.
And dealing with this directly, and also offering their spiritual support. I'm sure they're praying, but they're dealing with the sick and the symptoms and the medicine. So that was sort of an eye opener to me. I'm really glad you brought that out, that the church is attacking all levels of the response.
And even when you think of the history, right, of health services, the history of health services cannot be disconnected from the Catholic Church, right? The concept of missions, the concept of healthcare provision along pilgrimages back in the day, right, was fundamentally a church service. So it's funny that we often forget about it, but it's such an important bit to think through when we're talking about moments like this.
And when you bring up mission, I mean, most of these missions, it's either education or medicine. That's what they're doing out there.
Yeah, that's right. And often both.
Yeah. I found it really cool that there's an actual tracker for the economic stimulus package. I heard today on another call, I'd like to hear what you thought about this. I heard there was still at least $1 trillion left in the stimulus bill that has gone unused.
I have not dug into that bit, so I don't actually know. I wouldn't be super surprised, honestly, though. Mostly on like small business support. The breakout of it,
in that sense, yeah.
The breakout of it is a bit tricky to get a handle on. I've seen a visual, and I'll share a follow-up visual that shows like what was the intended use of all the components of the stimulus package. But I don't know anyone's actually been tracking like how much of it has actually gone out the door, who did it ultimately go to. And today we're dealing with a couple of those debates on like, should it be transparent? Should we actually publish out everywhere that it went to? And then there's like a pushback from small, medium businesses being like, actually, this is a breach of privacy, right? Like I shouldn't necessarily be shown on it. So a lot of these are going to be like the policy debates that exist during our time that will make it harder to actually understand what happened.
Got it. And was there any, whether through the government stimulus or through some of these foundations, was there anything for nonprofits to reach into and grab and then redistribute to individuals?
There's a couple of different ways that this has been happening. I don't know from a government standpoint, but philanthropic organizations and like a lot of the big foundations, Ford Foundation, Rockefeller, Gates, all of those have started to create these like pools of funds, and they've done two things with it. One is we're just going to create like an open, RFP for any NGO to submit an ask for unrestricted dollars, right? A bunch of NGOs right now are dealing with just like, I'm either hosting an emergency fund or I can't really get on like the right online systems to be able to serve my community. I'm dealing with more dollars than I can handle, or I can't actually even fund up the cash to be able to fundraise appropriately. That bit is one that I think private philanthropy has been trying to help solve. And it usually works through your like community foundations. Think of like the Knight Center or the Knight Foundation in Miami, the Women's Fund out of Miami. Those are probably the hub of where a lot of that stuff is happening. But there is dollars accessible. What I don't know is if a lot of it has actually come through government.
Got it. If you're done, if you don't have any more slides, just end there, and then
I'll show.
Oh, then we'll go into the speaker presentation. One of the things that you mentioned there on your last thoughts about what we can do, Nino Alvarez from the Puerto Rico chapter, he talked a little bit about the Bishop Barron video, and Bishop Barron challenges us on who is our neighbor during a crisis like this. Because we're not seeing people on a regular basis for the most part, and I think your challenge there on what I'm thinking of is, our neighbor is, in the broader sense, the larger communities who of individuals who are disenfranchised, who are suffering financially from this.
Yeah.
And there are ways. You brought up the COVID-19 emergency fund in the Archdiocese, and I almost kind of feel bad that we haven't promoted that very much, and we kind of could. But that's something that individuals, when you ask who is your neighbor, well, in this particular situation, my neighbor, in a broad sense, is somebody that may be in Homestead, the migrant farm workers. Yeah. There's actually there's a teacher down here. Her name is Miss D. She's from LaSalle. She's doing a lot of work with the migrant farm workers down in Homestead because there's nobody else looking after them. Mm-hmm. And she's involved with the Catholic Church and is going down there. So I brought up that came to mind, that we are challenged to rethink who our neighbor is. Mm-hmm. In this particular situation.
Yeah, a great point to bring up, and the dimension of who is our neighbor and knowing that actually can have a very expansive definition also brings up the question of, like, how can I help, whether it's very direct or indirect. These emergency funds and those are very good instruments to do a lot of that, but you do disconnect yourself a bit, and you're basically saying, I'm going to give my money and hope that the system is going to work a little bit better to be able to distribute that than I would. I encourage us to think about other ways too. I mean, even in the more immediate sense of, that there is someone that's a little bit older or literally in the neighborhood. Can I buy groceries for the individual? Think about other components of direct help, using your time, using your talents, and treasure. So don't discredit the money on this. Right. But yeah, all of those dimensions, I think, definitely come into play here.
And it takes a certain level of trust and courage. If you're going to, it's not going to be an indirect give. It's not going to be a direct give. It's going to be that indirect give, which takes that certain level of trust.
Okay.
And it's a challenge to us to step up and give and find our neighbor. I got some stuff coming in here through YouTube. And there's something else I wanted to attack the virtual and how the church is dealing with the sacraments. But before we get there, Benny Diaz has a couple comments. He says his wife had you as a student at St. Teresa.
Oh.
Did you go to St.
I did. I went to St. Teresa for a number of years and then went to Belen in 6th grade.
So she had you here. She had you as a student there at St. Teresa, Benny Diaz's wife. He's asking a couple questions. One of them is, if the Gates Foundation is involved at all in Cuba, particularly now with the COVID-19 crisis, do you know of anything that they may be doing there?
Yeah, I'd say the Gates Foundation isn't. And the Gates Foundation largely is not very involved in South or Latin America. We do most of our work India-oriented or African-oriented and sub-Saharan Africa. Mm-hmm. But there are a couple of our partners that definitely do. But yeah, that's the quick answer on it.
Got it. Yeah, because he's mentioning that, and the church is at the forefront there at the response in Cuba, and it goes to show what we talked about earlier. Most of the medical services, how the church is on the front lines of these things, and in these poorer countries, more so. Okay, let's switch. I want to switch to the sacraments. Tell us a little bit. I'll fill you in a little bit on what Miami has done, but what is Seattle doing there? What is the church doing with the sacraments? Have they opened up? Are you guys going back to mass? How did priests handle confessions during the closure?
Yeah, it's been mostly closed, honestly, here. And what I've seen has been more of the let's hold and defer, which is the part that got me most concerned, I think, about it. Right? I figure we would have been able to find a better way to do this during this time, even if it is temporary. But the response has largely been kind of hold and close and defer until later times, or private ceremonies where appropriate for weddings and such, for marriage. Confessions, I have not seen anything change here other than we'll consider it when we open and when we get to stage 3 for the state.
Yeah.
Yeah, but I'm really curious to see what other people have done, because I've heard and seen anecdotes of more creative approaches.
Well, yeah, we had a couple creative things here that didn't survive, but we also did small ceremonies. So very small baptisms and funerals were taking place, and weddings, I guess, as well. I heard of very small weddings taking place. Funerals more than most, not to prolong that particular celebration. But we had drive-through confessions here, and also in some cases I heard about drive-through communion. So there were some priests that would sit out in the parking lot and for a particular time, a 2-hour slot, and cars would line up in the parking lot, and you would drive up, open your window, call the priest who was 20 feet away, and he would look at it would be sort of like in person but over the phone in the parking lot, the confession. But that didn't really survive. The archdiocese down here didn't favor that particular practice, mostly for people gathering and folks were parking and getting out of their car and things, and it just didn't work out. And there were some other issues, but that didn't survive. We still were. I think you were able to call and schedule a confession and go in person, observe social distancing and things. But that unique drive-through phenomenon didn't last. But we are open now, and parishes are hosting mass with social distancing and masks. Some parishes will require you to sign up, essentially like get a virtual ticket, and if you don't sign up, you shouldn't go because they're going to turn you away. Some parishes are large enough; the buildings are large enough to accommodate the people that are coming. We still have a lot of people who don't want to venture out of their homes, especially now that cases have risen in Florida in the last week. A lot of the older populations and the vulnerable populations are not wanting to venture out. But one of the things, and I'm not 100% sure, and if there's somebody that is either on YouTube or in here in the room that can confirm, but I think one of the things here that hurt individuals was the inability to receive communion. Yeah. And if I'm not mistaken, the archdiocese was not allowing Eucharistic ministers to do visits to the sick or the elderly to distribute the communion for fear of the social distancing. So that was something that concerned a lot of folks, and I still think that's the case. I still think now for communion, it's just if you happen to go to mass, but we're not doing those visits to the home. Here's a question has come in, and if you know, how many people or what's your take on the younger population taking seriously the pandemic? And is there any education from the church to the young people? We had some serious cases here. I think you may have seen this. I forgot the state, but the state that recently opened up, they have a big lake. A bunch of people got together for a party, young people, and then a bunch of them got sick.
Missouri, I think.
But yeah.
The Ozarks, yeah.
Yes, the Ozarks, that's it. And it happened down here in Florida as well. They opened beaches in St. Augustine. In Miami, I've heard of cases of young folks getting together and half of them get sick. So what is your opinion on the youth taking seriously the pandemic, and is the church doing anything to educate them?
Yeah, it's a great question. I'm really curious as well, because when you think of cases where we've had upticks, right? Memorial Day weekend, I'm pretty scared of what's going to happen around 4th of July as well, right? Like these big holidays are the ones where you have a lot of flex time, and you have younger communities that are not taking it nearly seriously enough. So I don't know explicitly about the church. The messages that I've seen that have been shared by the church resonates very much with a lot of like the public health messaging that I think seems to appeal partially, but doesn't necessarily hit it right. This is not a responsibility about your own health, right? It's like you actually have to care about communal health. You have to care about public health, and it is about the society, right? Like to think of your grandparent, think of your parents bit. I don't know how much of it lands. It does. From what I've seen is that narrative lands a lot better in other countries. And one of the reasons is that the United States does have a couple of kind of political ideals that land this country on, the self-control and individual interest matters a lot, right? Yeah. And it becomes very real in a lot of our things, like how we think about managing money, how we think about social welfare, how we think about access to healthcare, right? In other countries, people believe that healthcare is a right for every single individual. Here we say we should have a little bit more control over what I do and what I choose to do. Mm-hmm. That also seems to trickle through in this mentality, right? I don't want to necessarily wear a mask because I'm not scared for my health, but me wearing a mask helps everybody else, 10x fold, right? That dissonance is a tough one to combat. So whoever asked the question, I mean, I share the concern. I do worry that it's not going to change substantially.
Yeah, I think you brought up the point there, right? And I've heard early on, at least, some of these on Twitter or social media, some of the younger generation would say, "Oh, I'm not going to, it's not going to affect me. So why should I be concerned? I'm not going to be sick. Why should I be concerned?" And I think that goes back to who is our neighbor and that mentality of we have a greater responsibility. And how are we going to instill that in our youth? And yeah, I didn't think about 4th of July. If Memorial Day is an example of what's going to happen 4th of July, we could continue to see these rising cases.
Yeah.
All right, very good. Oh, the virtual thing. I wanted to bring that up. The virtual thing. You guys in Seattle, you see a lot of virtual masses, parishes live streaming?
Yeah, we do. But I also just dial into some masses in Miami or in Atlanta as well to get some variety. But it's been all virtual. They adopted it very early, and they have a number of offerings throughout the day, plus recording. So you get to kind of follow your favorite priest if you want as well.
Right.
They've gone all in on it. So
yeah, I'm kind of curious of how much of this virtual communication will persist. I mean, there's no substitution for receiving communion. Absolution from the priest and baptism and things of that nature. But when it comes to community, this has been a pretty effective replacement. Not replacement, I should say, alternative, right? And a pretty effective alternative. So I'm very curious, especially with groups that we run with the Georgia Tech student group, or we do UM and Belen, how much, how long it's going to persist and how effective it will be. Maybe next year when we do have a more effective answer in the vaccine.
Yeah, I'm curious, but I think the potential is there. Not treating it as a substitute, but treating it as a point of entry to possible new faithful, or treating it as a kind of an add-on, perhaps. What I found interesting is we in the Atlanta chapter have a couple of times watched mass together and then had the meeting after, and that transaction cost is so low just to stay on and do a little bit more, that if your point of entry into the church has been watching a mass, you can always have community dialogue after, you can have one-on-ones, you can have all kinds of things that follow on immediately after. That increases your engagement and can actually do a slow walk to finally participating in person. And I think that is a really powerful tool that if we tap into and really go full force into after this moment of crisis, it could actually be a strong recruiting mechanism for the church.
Yeah, I agree. I know Father Science has implored us to make use of this technology in the sense that you're saying. I like that, a common point of entry. So good point. Good, David. Well, thank you so much for joining us all the way from Seattle. You're 3 hours behind?
We are 3 hours behind. Yeah.
So you still got a little daylight
late at night. I got daylight until 10 p.m. because we're so north. So.
That's right. Wow. Very good. So anybody watching, I encourage you to subscribe to our channel, click the bell if you want to receive notifications. Thank all of those who watched online. And thank you again, David. So be safe. God bless.
God bless.
And
thank you so much, Eric. Thanks, everyone.
And next week, 7:30 p.m. Take care.
Take care all.